Sir, am I audible, sir?
Yes, you're audible.
Okay, sir. Shall I start, sir? Om Shri Gurubhyo Namaha. Seeking the blessing of Lord Dhanvantari, a very good afternoon to one and all. I am Dr. Girish SM, second year PG scholar. Welcome you all to the third day of webinar series, MANOPRABHUTVA 2023. This program is being conducted on the eve of National Ayurveda Day 2023 and Golden Jubilee celebration of Department of PG Studies in Kayachikitsa Government Ayurveda Medical College, Mysuru. It is my immense pleasure and privilege to welcome you all for today's webinar on topic Ayurvedic Understanding and Management of Mood Disorders. In this regard, it is indeed delightful and a moment of proud privilege for Department of Kayachikitsa today to have with us a distinguished orator and an eminent Ayurvedic psychiatrist, Dr. Suhas Kumar Shetty sir, Principal and Medical Director, Kahers Shri BMK Ayurveda Mahavidyalaya, Shahapur, Belagavi, Karnataka, for today's session. Sir, we wholeheartedly welcome you for today's session, sir. Extending our invitation and respect to Principal Dr. Radhakrishna Ramarao, sir, Dr. Maitri, Madam, HOD, and staff of all PG Department and PG Scholars of GAMC Mysuru. And last but foremost, I welcome all the virtual participants of today's webinar. The majority of the world population in 21st century is being affected by non-communicable diseases, which includes mental health disorders. The World Health Organization in its World Health Report says 10% of total population suffers from a mental disorder. A man's creativity, his ideas, endurance can be ruined by common mental disorders like depression, anxiety, OCDs. The central theme of the World Mental Health Day 2023, which was celebrated in the present, that is 10th October, is mental health is a universal human right. It's emphasis on creating awareness, improving knowledge, and necessitate action to protect mental health. The facts being, 1 in every 10 people in the world live with a mental disorder. There are many different types of mental disorders. Effective prevention and treatment options exist, but most people do not have access to effective care. Today's topic of importance, mood disorders are a major type of psychiatric disorders characterized by a distorted or inconsistent mood that interferes with the day-to-day functioning of the individual. Mood disorders can often feel like a roller coaster of emotions, wherein an individual may feel an extreme emotional high at one point and an extreme emotional low at other point. With its varying prevalence of as low as 0.5 to as high as 78 per thousand population, mood disorders are causing burden to productivity of human life. With rising awareness of Ayurveda treatment modalities in a world of increasing mood disorders, today's topic of the webinar, Ayurvedic Understanding and Management of Mood Disorders, plays significant role. With this, briefly, I would request Dr. Shruti Erali to introduce today's guest speaker. Thank you.
Om Shri Gurubhyo Namaha. Good afternoon, everyone. I, Dr. Shruti Arali, second year PG scholar, feel privileged to introduce our today's guest speaker, Dr. Suhas Kumar Shetty sir. Sir is an Ayurveda practitioner, academician, researcher, and administrator specialized in mental health, research methodology, and medical statistics, having an experience of 18 and above years. Currently, Sir is holding a post and principal and medical director at KLA Academy of Higher Education and Research, Sri B.M. Kankanwadi Ayurveda Mahavidyalaya, Belgavi. Previously, Sir has executed the post of professor and head Department of Manovidyana Evam Manasaroga, Ayurveda Psychology and Psychiatry, and served as a dean at STM Ayurveda College and Hospital, Hassan. Sir is also an adjunct faculty at Southern California University of Health Science, California. Sir has been invited as a speaker in various international conferences and workshops across the globe. He is the member of editorial and review board of many scientific journals and has reviewed more than 72 scientific articles in various international peer-reviewed journals. Sir is the recipient of various academic awards like Contingent Grant Award from CCRA's New Delhi, Pratibha Puraskara Award for Social Service in the Treatment of Alcoholic Disorders and Paralysis, Bishop 2018 Best Doctor Award, Best Teacher of the Year 2021, Best Paper Presenter Award at various seminars and conferences. We from Department of Kaya Chikitsa feel extremely honored to have Dr. Suhas Kumar Shetty sir, today's guest speaker, to render his talk on Ayurvedic understanding and management of mood disorders. I welcome you, sir. Please take over, sir. Thank you.
Thank you. Thank you very much, all of you. At the outset, let me thank the organizers, especially the principal, Dr. Radhakrishnan sir, HOD of the Department of Kaya Chikitsa, Dr. Maitri ma'am, and all the faculties and the postgraduate students of the Department of Kaya Chikitsa for organizing this MANOPRABHUTVA 2023 as a part of a Golden Jubilee celebration of the department, as well as the National Ayurveda Day celebration of the year 2023. Indeed, it's a great privilege for all of us that the organizers have selected the mental health as a theme for this webinar series. I would like to really appreciate, acknowledge for identifying the mental health as the core area of their discussion. And also, I'd like to thank and oblige all the organizers for inviting me and making me a part of this memorable event. We had a great sessions by Dr. Niranjan Hegde and Dr. Parvati Devi Madam on the various aspects, the fundamental understanding and what Ayurveda can offer in the understanding as well as management of mental disorders. Today, we'll try to look into more specific about one set of disorders, which is very commonly seen in the practice term or under the domain of mood disorders. So I'd like to give you an overview of what is mood disorders and basically what's the difference between a mood and affect. What are the common mood disorders that we encounter in the practice? And then probably what are different clinical presentations that we could come across in India. And at the same time, what are the different treatment options that we have? So first of all, I try to cover the modern psychiatry part, like what is mood disorders, different classification of mood disorders, and go through the line of management that is generally followed in mood disorders. And then the majority of my focus would be how Ayurveda approaches towards mood disorders and try to add a lot of clinical touch with many of the case studies to be added in this discussion. So, of course, I'll be presenting for an hour, and later on, I'm very happy to take up the questions from the audience. And without further delay, I would like to start the presentation with sharing of my slides. So if one of you can just tell me whether you are able to just see the slides.
Sure, sir. Sure, sir.
Yeah.
Yes, sir.
Yeah. Are you able to see the slides?
Yes, sir.
The slides are moving?
Moving, sir.
Okay. Thank you.
Okay, sir.
Yeah.
Welcome, sir.
The topic of the discussion that we have today is Ayurvedic understanding as well as the management of mood disorders with a few of the case studies that we'll try to discuss. So before we talk about the mood disorders, it is very essential or very important that we try to differentiate what do you mean by mood and how this mood is different from affect. So basically, mood is a sustained and a pervasive attitude which colors the whole psychic life, whereas affect refers to a short lived emotional response to an idea or event. Like for example, somebody, you get annoyed or you get disturbed with somebody, or some, for example, a teacher scolds a student and students get a transient disturbances, and that is called as affect. But if it's persisting as maybe a low mood or feeling sad for a week together, a month together, that's where it becomes a mood. So affect is a present situations or a very short period of time. And when this continues for a sustainable period of time, and it really matches or covers the entire psychological phenomena of an individual, that's where we call it as a mood. Okay. And when there is a disturbance in the mood for considerable period of time, disturbing the personal life, the social life, the occupational life. So that is where we call it as a mood disorders. So we look at the classification of mood disorders. It basically has a manic episode, a depressive episode, a bipolar mood disorders, the recurrent depressive disorders, the persistent mood disorders, and other mood disorders. So we'll try to cover mainly with focusing on the manic episode, the depressive episode, and the bipolar disorders. So recurrent, as the word itself says, if there is a consistent recurrence of the depressive episode, like once in a month, once in 2 months, it is called as recurrent depressive episode. And then if it persist, the same mood persists for a considerable period of time, it is called as persistent mood episodes. Because most of these mood disorders comes as an episode. Like it's not very, most of the time it is not continuous in nature. It comes an episode where there is a flaring up of the mood either as an manic episode or could be as a depressive episode. Or sometimes it could consistently be a depressive episode or a manic episode. So we'll just try to look into these conditions and how we are able to have the various understanding of the same. So we look at the mania. So mania, as you know, the lifetime risk is between zero point 0.8 to 1%, and it tends to occur as an episodes. Generally, last in the clinical practice up to 3 to 4 months longer. Then they'll be followed by a complete clinical recovery. Like a person will be quite normal after maybe 3 months, 6 months down the line. And later on, a person could again have a future episode, which could be of either a manic episode or a depressive episode, or it could be a mixed manic and depressive episode. So how do present patient come to us when they are in the status of a mania? They basically would be like hyperactive. They will have a irritable mood or elated mood and very much increased activities. Like they'll not be able to sit in a particular place. They'll be wandering. They'll be very restless. Their speech also will be very fast and they'll be continuous. And very importantly, there should not be any underlying organic pathology. See, that is where probably whenever you are sitting in Manasroga OPD, you should never think that every patient who comes to you is having some psychological involvement. So always try to rule out the basic organic pathology. Try to see that it is not because of, nowadays you could see because of some endocrine dysfunctions, thyroid dysfunctions, it could be because of cardiac problems or any other major neurological conditions, which also could mimic like a psychological disorders. So always with thorough history, examination, and the clinical evaluation, try to rule out the possible underlying causes, and then you can come to a diagnosis if you're able to have a connectivity with a particular proper causes of a disease. And very, very importantly, that this manic episode should last for a considerable period of time, like at least for a week or so, and it should be able to disturb the occupational and the social activities. So there are different stages of mania that we talk about in the clinical practice, spanning from euphoria, elation, exaltation, and the ecstasy, which are like higher grading of the different types of mania. So coming to the depression, the overall lifetime risk is more in female as compared with the male, and it could be ranging somewhere between 8 to 30% in a lifetime. Most importantly, the common symptoms that we come across would be like a depressed mood, depressed ideations. There could be, a person likes to stay alone, doesn't like to interact with anybody, either person do not take food properly or they takes food in excess, no sleep, insomnia, and also sometimes it could be associated with some psychotic features like hallucinations, delusions. Most importantly, they could be suicidal attempts or ideations or the thoughts. Again, there should not be any underlying organic pathology. The classical triad that we always talk about depression is the helplessness, hopelessness, and worthlessness. A person feels that there is no future, is of no use to anybody in the society, and he cannot see any help that is there in the surroundings. See, though these are the classical signs and symptoms of depression, but if you look at the developing country like India, or that too in the like a tier two or tier one cities or in the rural population, most of the patients do not come with these classical symptoms. So that is where it's always a challenge for a psychiatrist or patient to identify depression in the Indian population, because many of them come with the atypical symptoms, which could be because of headache or body ache or any GI symptoms or aches, etc. So when you explore the possibilities, you come to know that there is some psychological involvement. So always, this is one of the biggest challenge that we have with mood disorders, is that most oftenly, the patient do not come with a very classical symptoms of depression. So let's just look into one of the case scenario or case study and see how patients come to these presentations and how Ayurveda could be of help to them. So this is a 32-year-old female who has come to the OPD with a history of persistent sadness of mood, crying spells, disturbed sleep, generalized anxiety. If we look at the premorbid personality, personally she had low mood for more than 10 years, no other relevant medical or psychiatric history, but there was always a conflict regarding the inability to beget a child even after 10 years of married life. There was often the social isolation following the misbehavior of the alcoholic husband. There was many times physical and verbal abuse by the husband, and she also had suffered with the left-sided hemiparesis following the head injury 2 months back. If you look at the psychological evaluation or the mental status examination, the physical appearance was normal, well groomed, but the speech was reduced with a low rate of speech, a decreased tone of speech. The mood was sad, irritable, and especially the anhedonia was present, like there was no liking to do anything that was earlier interesting to her. And the thought process was normal. And if you look at the other perception, cognition, it was said to be normal. So ideally, a presentation with Vata Kshaya Lakshanas and the Kapha Vriddhi Lakshanas, and the most often evaluation of the dosha is Rasadhatu. Agni was Sama, Koshta was Madhyama, the Vata Pitta Prakriti lady involving the Srotas, and especially the Manovaha doshas involving the Rasa and the Tamo gunas, especially the Rajokshaya and the Tamo Vriddhi were present. There was the Sanya Jnana, Bhakti, and Shira Vibhrama was present. So the ideal diagnosis would be to go with the moderate depression as per the DSM-5 because of the depressed mood, loss of interest, and insomnia. And as per the ICD-10 coding, it is F32.11, which is about the moderate depressive episode. The patient was evaluated with the Hamilton Depression Rating Scale, which is a common scale for depression, and the value was 14, indicative of moderate severity or moderate depression. So the final diagnosis was moderate depressive episode, which in Ayurveda, mild to moderate we consider as Vishada, and moderate to severe, which is considered as Kafaja Unmada. So the line of treatment that was followed during the stay of the IPD patient was Takradhara, the Shiropichu using Jatamamsi, Amalaki, and Brahmi, the Sarvanga Udvartana with and Parishika using Dashamala Kwatha, Panchakola Fanta, 50 ml thrice daily before food. And then the patient was, once there is Deepana Pachana and Agni Deepana was present, the Snehapana was done using Pancha Gavya Grita, which is an ideal Grita for Kapha dominant symptoms. And the patient was given Snehapana for 5 days from the Snehapana dose from 30 ml to 250 ml, followed by Sarvanga Abhyanga and Virechana using Trivritleha and Draksha Kashaya. So the patient had 14 Vegas, and after the Samsarjana, the patient was advised with only one medicine, that is Panchagavyakrita 10 ml BD for 30 days. Along with that, the sessions of counseling, daily counseling, the progressive muscular relaxation twice daily, yoga, pranayama, and trataka was done twice daily. So this is what is the intervention that was done to the patient, and the patient was again assessed after 30 days, and there was a significant improvement in her mood, and the crying spells were significantly reduced, and the patient was telling that I'm able to feel fresh. Again, the Hamilton depression scale was applied, and which was 14 earlier was reduced to 10 in a month. So again, there was no adverse event which was noticed during the particular period of time. Again, this is a patient feedback. Maybe I'll share later on. So to discuss about this, no, basically you should do the Dipanapachana in such conditions, followed by if the patient has undergone these symptoms for quite long period of time, like 8 years or 10 years or etc. It's always better that you can go with the Shodhana process, then followed by Shamana Aushadhis, and above all, like a proper advice regarding the Ahara, Vihara, and the Sattvaja Chikitsa is very, very important. And again, most importantly is how do you select the Shamana Aushadhis based on the dosha, based on a Falashruti, and based on the patient's suitability or compliance, you try to select the medicines. So, moving on to the next set of mood disorders, which is commonly seen in the practice, is the bipolar mood disorders, which is characterized by recurrent episodes of mania and depression. And sometimes there will be depressive episodes, and sometimes there will be manic episodes. Again, it's of two types: the bipolar type 1 and bipolar type 2, where in type 1 there will be depressive episodes with manic episodes, and in type 2 there will be depressive episodes with the hypomanic symptoms. So ideally, earlier it was called as manic depressive psychosis, and no more it is diagnosed as manic depressive psychosis now. It could be with any of the presenting symptoms like hypomanic, mania without psychosis, mania with psychotic symptoms, depression, and as I said, it could be of bipolar 1 or bipolar 2. Again, we'll just see one more such cases where a 30-year-old male patients coming to the OPD with very irritable, hyperactive symptoms with persistent negative thoughts, palpitation, reduced sleep, aggressive talk, and difficulty in concentrating and focusing. The patient was not able to sit in one place, shouting a lot, and there'll be occasional thought blocks also. He also had a health anxiety symptoms. So he always had a previous episodes of mania and depression. There was 2 episodes of mania and 3 episodes of depression. There was also one-time cannabis use of the patients. So the patients had also earlier taken 2 times IPD symptoms treatment for the same. So earlier the patient was always afraid of that his father or uncle died because of the cardiac arrest, and he always had this anxiousness about the health condition. So when you see the patient physical appearance was said to be normal, though the mood was very anxious and irritable and restlessness. The thought process was between blocking and hyperactive. The perception and other things were said to be normal. So there was significant irritability, which was Vata and Pitta Vriddhi was there, and other main symptoms was Chesta Vibhrama, Manovibhrama, and the Buddhi Vibhrama. So ideally, the diagnosis would be the bipolar mode disorders because of the recurrent attacks of the manic and depressive episodes. And at present, the patient had manic episode, but without any psychotic symptoms. So ideally, if it is Vata Pitta dominant symptoms are present, you can always go for Taila Dhara using Shirabala Taila or Tunga Drumadi Taila, Brahmi Taila, Shiropichu with Jatamamsi, Amlaki, and Brahmi, Udvartana, and for Deepanapachana Chitrakadi Vati, Snehapana with Kalyanaka Grita with a dose from 30 to 300 ml was done. Again, in Manasroga, very often you can also go for the Prabhuta Snehapana, then Sarvanga Abhyanga with Mahanana Tela, and the Virechana with Avipatikara Churna. And after the Samsarjana, the patient was advised with the Manasamitravati and Sastarishta for 30 days. And again, Along with that, most importantly, the Sattvaja Chikitsa and the other psychotherapies, yoga, meditation, and Trataka was advised. And significant reduction was there in the patients after 30 days. So we look at the common causes why people suffer with mood disorders. There are again various theories which have been mentioned. There are biological theories and the psychosocial theories, which includes genetic theory, biochemical theories, sleep theories, and there are a lot of changes happening in the brain. At the same time, we cannot ignore the indulgence or the impact of the psychosocial causes like the psychoanalytical theories, the cognitive behavioral theories, and above all, the stress. Like very often, in fact, yesterday we got a patient where the patient was always not happy with the environment in the family because the father and mother always were fighting and he always was used to get disturbed. And also he got around 85% in the SLC marks card. He was sent to a training center for IIT coaching where he was not able to cope up with this particular stress. And there was a lot of even bullying by the friends and other people. So he totally got into very severe depression, and he also was suffering with various hallucinations and other symptoms. So the patient was diagnosed with bipolar disorders with the depressive episode with psychotic features, which urgently needs like sometimes if the patient is very severe, even some antipsychotics also need to be added to the patients. So ideally, you can differentiate. The prognosis is most important. The bipolar disorders are having better prognosis as compared with the schizophrenia, and those patients who have recent onset with typical symptoms and those who respond or well-adjusted premorbid personalities, generally they respond well to the conditions. So ideally, if you look at the management of the mood disorders, it is mainly categorized into three: the pharmacological treatment, the psychotherapy, and the electroconvulsive therapy, which is commonly called as the shock therapy or the ECT. So you always try to go with the pharmacological treatment in most of the conditions, and generally it takes around 3 weeks time. So that's the reason why suppose you're starting with any antidepressants or any mood stabilizers, you should always tell the patient that you will get considerable difference in the symptoms only after a month. And then the patient, because you should not change or dose or the medications within 3 to 4 weeks, because generally it takes sufficient time for the mode of action to be clearly visible to the patients. So always give at least 6 weeks or even 8 weeks time before you switch on to the other medications, change the medicines, or even increase the dose of the medicines. So ideal pharmacotherapy, which is commonly used, like suppose if it is, you have to differentiate whether you go with antipsychotics or antidepressants or the mood stabilizers. The ideal antidepressant that is commonly used includes the tricyclic antidepressants like imipramine, etc. But the problem is that imipramine and other tricyclic antidepressants have lot of side effects. So that is why we go with the newer antidepressants, which includes the specific serotonin reuptake inhibitors like sertraline or citalopram, etc. And also you can think of the monoamino oxidase inhibitors. But one should be careful when you're using the monoamine oxidase inhibitors, the drug-food interaction. Though one more line of treatment, which is again commonly followed, is electroconvulsive therapy, which is the choice in case of severe depression with suicidal risk, those who have stupor or severe psychomotor retardation. Even recently, also we had done this particular therapy to the patients who are really having a lot of like something called as apathy or total mutism. Patient was there where this was conducted just a couple of days back. Then severe depression with the refractory depressive episodes, and especially this clinical conditions usually around 6 to 8 sittings are done, and ideally 2 or 3 times in a week. So one more medicines which is commonly practiced, especially for mood stabilizers, especially for the patients of manic episodes, is lithium. It's a drug of choice, and it's given a dose of 900 to 1500 mg. But only challenge with lithium is there's a very short window period between the therapeutic dose and the lethal dose. And it is like if it is point up to zero point 0.2 or zero point 0.4, it is okay. But if it goes beyond 2, then it becomes toxic. And if it's going beyond 2.5, it can be fatal also. So you should be very, very careful when one is using the lithium. Always you should monitor the blood test before you initiate also. Many of the common investigations should be done. So other you can always add the antipsychotics the risperidone or a clonazepam, etc. if there are other symptoms. And other mood stabilizers includes the sodium valproate, carbamazepine, etc., which also would be very beneficial in some of the conditions. Most importantly, we go with the non-pharmacological treatment, which mainly includes the cognitive behavioral therapy, the interpersonal therapy, the psychoanalytical psychotherapy, behavioral therapy, group therapy, family therapy, marital therapy. All of them we generally practice in the mood disorders, and which really are helpful. And in some cases, we even don't need any medications. You can effectively manage. I think around 15 to 20% of the patients you can easily manage without any medications purely by this non-pharmacological treatment. So coming to how Ayurveda approaches towards these mood disorders. So ideally, it's very, very important we go with the Hetu, Linga and Aushadha Trisutra Ayurveda. And if you look at the mood disorders, how patients comes and whatever patients are more prone or susceptible for mood disorders. So based on the experience that we have for the last 2.5 decades, commonly I feel that the patient who are the Kapha Prakriti person or Vata Prakriti person, and especially those who are Tamasika Kaya or the Rajasika Kaya, are more prone for mood disorders. And those who are having Avarasattva are suffering with mood disorders, especially the life events. So if there is a loss of a dear one or change of job, going for a new situation, getting married, getting pregnant, changing of the job, or if there is a financial crisis. So they are the major reason why there is always a mood disorder, especially the depressive episodes, or sometimes some people will exhibit that as a the manic episode also, or if they have a like a poor dietary habits like keeping for a long time, or if they're using a lot of a carbonated drink or a lot of fast foods, junk foods, and do not have a proper idea about their digestive process. And again, those who have lack of exercise, day sleep, elderly population, again, elderly population also are more prone for mood disorders. Sometimes the mood disorders can also be secondary to the medical conditions. And very oftenly, what we have experienced is the patients who have like Vata Jwara, Pakshagata, Madhumeha, Kampavata, Arbuda patients, very oftenly complaints of mood disorders, and that too typically of a depressive episodes. So most often you need to evaluate the Dharaniya Vegas, which could be the reason why there is always the onset or the flaring up of the symptoms like anger, greed, or it could be exhaustion, klama, shrama, etc., which need to be evaluated. So you need to differentiate. Like suppose a patient comes with mood disorders, you have to categorize them with, I mean, one of them, whether it is a purely a psychological origin, or whether it is like because of some the sharika doshas like vata, pitta, kapha, or it is because of the psychosomatic origin, or whether the somatic symptoms are arising because of the psychological causes. So this classification is very, very vital, irrespective of any of the psychological disorders, and most appropriately for the mood disorders that we should be able to differentiate. And then look into at what level of the samprapti the patient is complaining of, whether it is at dhi, driti, or smriti. See, ideally, dhi is when there is a impaired intellectual resulting in indecisiveness. A paper is not having proper perception, and there is a abnormal thoughts are present. Next, the dhriti, when a person do not have a control on the self, or there is a lot of confusion is always there in making a decision, or if it is smriti, when there is a poor recall and the memory. So ideally, like though it is not mentioned textually, but as per the clinical practice, you can always differentiate the mood disorders as the endogenous mood disorders and the exogenous mood disorders. Very oftenly, even in young children or elderly population, you find the endogenous depression, and in the middle age, the exogenous mood depression. You can also categorize the mood disorders as Vataja, Pittaja, Kafaja, and Sannipataja, or Tamopradhana and the Rajopradhana. I'll just give one example. Suppose a patient comes to you with a depression. You can again subclassify them as Vata dominant, Pitta dominant, and Kapha dominant. And this becomes very, very vital for you to choose the therapy and the medications. Ideally, if you look at what are the typical symptoms of water dominant, what are the common causes and symptoms, like there could be excessive sleep or use of dry frozen foods, sitting long time in AC. Ideally, they will have the irrational cataphoric ideations, restlessness, unable to concentrate, pitta dominant like irritable, anger, and suicidal ideations. Kapha dominant people very again lethargic, obeys, and lack of motivation, stays alone, etc. So one should always be careful. There are some red flags which should be one should be very, very careful when you're dealing with the mood disorders. Most importantly are the suicidal ideations. So if at all the patient has suicidal ideations, always try to ensure that you are not being able to give good assurance. You should be able to have a good assurance to the patients and ensure that it should not be neglected. Bring it to the notice of the family members and see that they are not kept alone, they do not lock their room, and always observe for their behavioral changes, biological changes about their sleep, mood, etc., and also the eating habits. Because if at all there is a thought, always there will be some form of attempts which will be done. Because earlier we used to always think that we should not talk about this suicidal tendencies, but you always feel that if at all it is there, you should try to explore it, you should try to take it out and clear all the possible. See, the problem in India again is not with the no that we do not have information. We have wrong informations. We have misinterpretations, misconcepts, which is more prevalent than the actual authentic scientific information. So always try to give them the scientific informations, and that is why I always feel that if we are able to do that, we can always be able to help the patients. Other important thing is the mood disorders in the elderly. Also, sometimes because the challenge why we have this in elderly is because of the comorbidity, because they also could be suffering with diabetes, hypertension, stroke, etc. So always be extra vigilant when treating the depressive disorders or the mood disorders in the elderly population. Most oftenly they also would have some form of sleep disorders, where you can always take the help of shirodhara, shirobasti, or even we have also come out with something called as lalata basti, where we are trying to use grita preparations in case of such conditions. You can definitely use the nasya are very, very beneficial. And if the patient lacks a little bit of motivation, the pradhama nasya, anjana, or even the dhupana are said to be very, very beneficial. That is what the patient has substance abuse, depressive episodes. You always would definitely get wonderful results when you use the dhupana is done, like Shirshadi dhupana, Manashiladi dhupana, Haridradi dhupana, etc. can be used. We always think that the mood disorders or depression is always the problem of the elderly, or it could be of the problem of the old age. In fact, if you look at the present OPD, we come have children of 7 years, 8 years who have these depressive episodes, though they do not have classical symptoms, but they have this. And the main reason for this is that many times both the parents are working and they are not able to give the quality time to the child, and this is where the child could go and child is not able to share its or her or his own feelings. When you try to classify how do you treat the mood disorders, again we try to go with the trivida aushadis, like the daiva pasha chikitsa, yitva pasha chikitsa, and the sattvaja chikitsa. So if you like to differentiate when to use Daivaparsha, when to use Yuktyoparsha in mood disorders. So Daivaparsha is ideally used when the causes are not very clear, when the doshic parameters or the doshic analysis, Agni, etc., we are not able to do, and you have to focus on the Vyadhi. Suppose you are able to identify the causes, doshic pattern, and the doshic assessment is done, then Yuktyoparsha Chikitsa in the form of dosha pratinika can always be advised. There are various Devapasha Chikitsa which are very beneficial, like mantra chanting, like you have the Om chanting, Mrityunjaya mantra, and a lot of researches have been done and saying in its spiritual well-being and performing of Agnihotra Homa, and especially encouraging a person for going to the pilgrimage, the Tirth can also be very, very beneficial, especially in case of a depressive episodes. So, of course, Yuktya Pasha Chikitsa, one can always try to go with the Antaparimarjana, Biparimarjana, and in some cases, there is also psycho surgeries which are being performed in case of the mood disorders. Ideally, when do you perform the Panchakarma in case of the mood disorders? Ideally, Vamana is said to be beneficial if the mood disorders is severe, chronic, kapha dominant. Virechana, mild to moderate mood disorders with Pitta and Vata dominant conditions. Basti, if it is chronic, Vata. And especially Nasya, especially the Pradhaman Nasya or Tikshna Nasya, to be done using when there is need to be some stimulant and the patient do not have motivation. So this is what we commonly perform. Kapha Pradhana mood disorders, going with Vamana, Pitta Pradhana with Virechana. And again, Vata Pradhana, we go with like Mustadyapan Basti or Madhu Tailika Basti, or even the various types of, if you want a little bit of Shodhana, do with the Erandamuladi and the Dashamula Basti, then follow with the Brahmana or the Yapan Basti can be done. Nasya is said to be one of the very, very beneficial, especially in the elderly population. If it is associated with endogenous depression, you can go with Pradhaman Nasya using the Katfala Churna or the Vacha Churna or the powder of Bharatvada Chintamani Rasa can be, or Shwasakuta Rasa powder, 2 to 3 tablets can be done and can be used very, very effectively. The Masha Nasya, sometimes if you need Brahmana Nasya, you can use Shirabala 101 Avrata or Kalyanaka Grita, Brahmi Grita, Panchagavya Grita can be used for Nasya. Again, if there is problem with in the sleep disorders and initiation, and if it is kapha dominant conditions, go with Takradhara. If it is Vata dominant, you can go with the Tailadhara to the patients. Again, we have tried to come up with this new modality of treatment called as Shiro Mardhana. Again, we can do the Snigdha Mardhana as well as Ruksha Mardhana based on the doshic dominance, especially using the Brahmi, Sarpagandha and Jetamamsi. And suppose if it is because of some withdrawal symptoms of some substance abuse, again, the whole how the procedure is done, we have published these cases as a novel approach towards the withdrawal symptoms. Again, as I said, Dhupana can also be done, especially those who have kapha dominant symptoms, lack of motivation, loneliness, like tushti bhava, abhikshtam apasmarantam, etc. Then Dhupana, as I said, again, especially in initial symptoms of lack of motivation, they do not want to take treatment. This is again one of the biggest challenge. The patients are not only interested in life, because they're also not interested to take the treatment. When it comes to the Manasika Rogas or the Manasika problems, one of the best medicines, like wonder medicine that we can always use is the Purana Grita. And especially in the mood disorders, we can always try to use the mood disorders. Again, if there's kapha dominant symptoms are present, if there's lack of motivation, a person is feeling loneliness, and the person do not know why exactly he is feeling sad. In such conditions, there's a significant importance of the Purana Gritas. We basically did try to see what basically is the difference in the Grita that is prepared freshly and that is kept for 1 year. And there's a significant difference in the saponification value and more importantly, the iodine value, which is the reason why there's a significant difference or effectiveness in the psychological disorders because it can cross the blood-brain barrier. Some of the single drugs that can be used in cases of the mood disorders, like Yeshtimadu, because of its blocking the serotonin reuptake and acts just like a specific serotonin reuptake inhibitors. The Haridra acts like a monoamino oxidase A receptor inhibitions. Especially if there's a stress and you would like to have the mood disorders. It works like non-adrenogenic receptors and also an effective antioxidants. Again, when you want to use with some modern medications, you want to use some Ayurveda, Amlak is said to be a good adjuvant therapy. And there are a lot of research which has been shown that Brahmi is as good as comparable with the tricyclic antidepressants in the form of imipramine. Even Tulsi is also like that's the reason why they give this Tulsi Tirtha when we go to the temple as a very effective stress adaptogenic. One of the most important, suppose you want to have the mood stabilizers, it's in the form of ashwagandha. You can use 3 grams ashwagandha twice daily with milk for at least 6 weeks. Very effective. Similarly is the guduchi, and especially if you want to, there is kapha dominant symptoms are present, you can always add attenuate the shunti in such conditions. The ideal Shamanaushadhi that you can use in the mood disorders, again, you can classify it as Vata dominant symptoms, Pitta dominant symptoms, and Kapha dominant symptoms. For Vata dominant symptoms, Kalyanaka Grita and Mahakalyanaka Grita. Pitta dominant symptoms, Brahmi and Kushmanda Sadhita Yeshtimadu Grita. And Panchagavya Grita and Lashunadi Grita, Apara Lashunadi Grita can be used in case of the Shamanaushadhis. Other commonly used shaman aushadhis which are used in different context includes the even it could be rasaushadhis also like Unmada Gaja Kesar Rasa, Chaturmukha Rasa, Shastarishta, and Brahmi Dakshadi Kashaya mentioned in Sastra Yoga is also very beneficial in the Vata Pitta dominant type of mood disorders. And once you do this Shodhana and Shamana, it's also important that you can do the Rasana Prayoga, and especially the use of Medhya Rasayanas. So you can classify how to use this Medhya Rasayanas. Like you can always use the Shita Virya, Madhur Vipaka Medhya Rasayanas like Yashti Madhu, Brahmi and Shankapushpi, where you are focusing at the Dharana Shakti. And suppose you want to focus on the Grahani and Smarana Shakti, use the Tikta and the Ushna Virya dominant Rasana Prayoga like Guduchi, Vacha, and the Jyotishmati. So the most important approach that you always need to do in case of the mood disorders is the Sattva Chikitsa. And you use generally different therapies, especially as mentioned in Charaka Sutrasthana, Manaso Jnana Vijnanam, Dhairya Smriti Samadhi. Like, and especially if you want to adopt in the mood disorders. So the Jnana is like Atmadi Jnana, Atma, Desha, Kula, Kala, Bala, Shakti. Based on these variants and variables, we should be able to fix different modules. Vijnana is the cognitive behavioral therapy that you can apply. Dhairya is Anunadi Chetasa in the form of motivational enhancement therapies. And always try to, because distract the patient's mind towards the negative things. And different types of yoga practices could be any forms of Ashtanga yoga practices can also always be used in the management of mood disorders. The most important thing is always try to encourage the patient to talk and try to identify their interest. And this one, like this was a patient who had come from South Africa, and the patient had always had an interest of playing guitar, and she had almost lost the pleasure of playing this for the last 4 years. So again, when we got this and asked her to pay, well, then it was really so much of change that you can always see in the patients. So it could be of any age, maybe child, adolescent, male, female, elderly population. The most important thing is try to identify the cause of the conditions and try to see how best you are able to help them to Sattva Chikitsa. So I strongly believe that if the problem is in the mind, the problem is in the thought, the problem is with the overall emotions and mood, any medicines will not help until unless there is a self-orientation. So that is why the Atmadi Jnana has been given most importance in Ayurvedic approach. So it could be like young college going or those people who are already on some occupations. Give sufficient time and try to evaluate them and give that motivation. So ideally, the therapy that we do it fully for 20 to 30 minutes, which has five steps that is involved: developing the rapport, then evaluating the cause, implementing the appropriate therapy, then giving them the assignments or task or doing the review of their outcome, and then ending the session with like next follow up. So this is how ideally we do the one session of psychotherapy, and then the patient is already giving a great response. At the same time, it's also important for we doctors also to take care of our health, because we can always heal others if we can heal yourself. So the self care for the doctors is also equally important. So have some sadhana so that you are able to take care in the form of some yogic practices, meditation, yoga nidra, some form of pranic healing is always advisable for the doctor colleagues. So we can always advise the diet specifically. There are a lot of research which have been done, and the newer branch which is coming up is nutritional psychiatry and preventive psychiatry, which already Ayurveda has already believed as swasthasya swasthya rakshanam. There are specific diet which has been mentioned, and just give an example of what we generally advise in depression is to ensure that they always are on high proteins, encourage vegetables and fruits, and no to the red meat, especially the pork and the beef. Good amount of servings of the vegetables, fruits, the things which are rich in vitamin C, beta carotene, folate, etc., like carrot, spinach, sweet potato, apricot, pumpkin. Again, pumpkin and that too, ash god like kushmanda. You can ask the patient to take kushmanda rasa around 40 to 50 ml twice daily with honey or sugar candy for 6 to 8 weeks. It's a very good dietary prescription for patients suffering with depression. So you can also try to classify them based on the whether which prakriti they are and which rasa dominant they are, what type of the grains and cereals they are trying to use. So you can always use the different charts and always try to give them the proper based on their satmya, their based on their usefulness. You can always try to give them. So there are some like patya and apatya which you should always try to tell them, like the dates, sugarcane juice, leafy vegetables, porridge, veg stews, polenta, etc., which can always be advised, and ask them to avoid the spicy foods, oily foods, non-vegetarian diet are ideally said to be avoiding in nature. Try to encourage them with some form of physical activities, maybe the yoga or aerobic exercises, dynamic exercises, because they really improve their self-esteem, a significant increase in the endorphins. If at all there is some pain, aches, etc., it gets relieved and they get very good sleep. So this was ideally what the setup we have done for mental health unit, or also for the de-addiction unit in the hospital, where we have the therapy rooms for consultation rooms, the IPD and the diet sections, the activity room, and also the rooms where we can do the individual and the group counseling are always done. So the most important thing is to have the preventive strategies for the mood disorders, specifically for the mental health and the emotional well-being, which we commonly call it as ABCD 4321, where A stands for away from distraction, B for better planning of the life and priority of the life, being happy, being cheerful, being having the purpose of life is very very important. Indulging in some form of daily activities, at least 20 to 30 minutes, 5 times a week is very very ideal. Sufficient quantity of water, 3 times timely food, 2 times of prayer, and at least one recreational activities, maybe in the form of singing, dancing, swimming, going for a long ride or going for a movie, etc., can always be very very helpful in patients suffering with mood disorders. So to conclude, ideally, most of the mood disorders, it could be either manic or it could be depressive episodes, or again, It could be both the bipolar disorders. So the ideal therapies, Shamana Aushadhis and the Sattva Chikitsa that can be followed in these conditions. If it is depressive episodes, one can go with Vamana and Nasya. The ideal Shamana Aushadhi for the depressive episodes include Jyotishmati, especially the Jyotishmati oil, 8 to 10 drops, Jatamamsi, Panchagavyagrita. And psychotherapy would be supportive psychotherapy and dynamic exercise, and of course, a little bit of motivation. The Pittaja Unmada Chikitsa can be done in case of manic episodes. Ideally, Virechana, Talapodi chill, or Murdi Tailas are beneficial. Shamana Aushadhi like Ashwagandha, Tagara, Brahmi. Tagara is said to be very, very beneficial if there is anxiety symptoms are present. It's a very good anxiolytic drug. Manasamitravati and other relaxation techniques like Jacobson's muscular relaxation techniques, yoga, pranayama, and that too Nadi Shuddhi pranayama. And if it is again Vata Pitta conditions, you can always go with Surya Bhedana or Chandra Bhedana. And Brahmari pranayama are said to be beneficial in case of manic episodes. So I would like to acknowledge once again the entire Department of Kaya Chikitsa of Government Ayurvedic College, Mysore, my institution, both KLE as well as SDM, and especially all my health seekers with whom I always have been a great learning experience for me. And even today, I always try to see that I learn with each patient that I try to encounter. They have been my great source of learning throughout my life. Once again, I'd like to thank the organizers. And if there are any questions from the audience, I'll be very happy to answer. Thank you very much.
Sir, thank you so much, sir, for such a easily understandable session. Thanks for very informative session, sir.
Yeah, if there are any questions, I'll be very happy to answer.
Yes, sir. Great for a few minutes, sir.
Sure.
Yes.
The question has to come from Mysore to Belgaum. It will take some time.
Sir. Sir, one question, it's on screen, sir, now.
Yeah.
Can you please explain practical difficulties in treating mood disorders?
Yeah. See, the most important thing is, as I said, one thing is about in most of the general practice, patient do not come with the typical symptoms of mood disorders. So as they come as headache or insomnia, back pain, etc. And then you find when you try to evaluate, then you come to know that it is because of some mood disorders. And also there are some mood disorders which are because of seasons, something called a SAD, seasonal affective disorders, which could be because of some seasons, which again you do not know why it is flaring up. And when you see that it is because during winter the symptoms are flaring up, or a particular season that it is flaring up, it could be because of some mood really exaggerating because of some seasons also. So these are sometimes very challenging things to identify itself is a most important challenge. See, one more very important challenge that we have in the Indian population is that many of the patients do not seek help. If you look at the statistics, more than 70 to 89% of the patients suffering with psychiatric disorders or the mood disorders do not seek help. And they say that it is because of some psychological, like other physical symptoms, etc. The other important challenges that we always have is those patients who are very, very violent, very irritable. Like there is a severe manic episode is there. There again, not very easy to be treated by general physicians. They definitely need to be referred to a specialist, and that too sometimes we are not able to manage it at a OPD level. So they need to be put on some antipsychotics, and they could be restrained sometimes to have these problems. Other patients who are pregnant, who are already on medications, who are like if they are children or elderly population, they are the people who are sometimes uh, high risk populations or patients with a lot of care that you should be able to work upon them. So these are few of the challenges that we always have in treating the mood disorders.
Thank you, sir. Sir, there is one more question, sir. Sir,
Sure.
please explain treatment protocol in postmenopausal depression or mania, sir.
Yeah. See, as you know that the few of the uh, phases of the life, especially in the female's life, like it could be premenopausal or it could be premenstrual or it could be perimenopausal stage, where automatically there are some form of hormones which could attenuate with the symptoms. So in such conditions, definitely like in the modern, as they do this hormonal replacement therapies are done. You can always use them like rasayana therapies. Start these medicines maybe a decade before like their symptoms, like in the third decade or in the early fourth decade. We can always start with some medications, ideally like Manduka Parni, Shetavari, or Yashti Madhu. They're all said to be very, very beneficial in case of the postmenopausal depressive symptoms, as well as if it is mania, again, you can go with some other Shamana Aushadhis like Drakshadi Kashaya, Brahmi Drakshadi Kashaya, or Kalyanaka Grita, etc. They are said to be beneficial in cases of a menopausal phase. But always at the same time, it's a natural phenomena. Always know that there could be a patient who is will undergo a particular. It is the expected, it is not the answer, it is not unexpected phase of a life. So it is like, a person is getting retired or a person is getting premenopausal symptoms. So it is always better that they should have some form of awareness. Self awareness is always very, very important. The self care, like what we commonly call as the Atma Jnana, becomes very vital in case of the menopausal depressive or the manic episodes. Preventive aspects of mood disorders before a person ending up with a disease. Yeah, of course. If at all a person has initial symptoms of some mood disturbances, so it's very common. I think everybody will have some mood disturbances. If you talk to anybody, today my mood is not good. I don't feel like going to college today. I don't know why there is no interest. So there's a lot of, as you know, there is so much of internal stressors or external stressors which always will have an impact on our mood and our emotions, feelings. So always, if there are any such symptoms, all the most important thing is indulging in some physical activities or indulging in some activities which is like a stress buster. Be going for a short picnic or for a short trip, talking to your friends, talking to your elderly people, talking to your parents, and so who really could be of much use to you. So they are very, very useful. And maybe hearing to some motivational talks which sometimes be more beneficial. But if it persists, it's always better that you could go to a mental health professionals. Yeah. See, there are many vitamins, minerals which have been associated with psychiatric disorders. See, basically, as you all know, that there is a strong relationship between the gut and the brain. And nowadays, you all are might be very much aware of this gut-brain axis because a lot of around 80 to 90% of the like serotonin or even other neurotransmitters are in fact related with the GI tract. And if and the vitamin B12 is very, very important for the absorption of many of the vitamins. It is very, very vital. So if a person takes care about his gut health and no, that's why maintains a good gut balance. Like for example, ideally, like a ginger and the rock salt, if it is used before food for at least 10 to 15 days, is ideally a very good therapy. And also the pomegranate juice is said to be very very beneficial when there is vitamin B12 deficiency, and also sometimes vitamin D also, it's also associated with the vitamin B12. One should be able to do that. So ideally, the message here would be to ensure that there is a good gut health be maintained in many of the psychological disorders. Elaborate cognitive behavioral therapy. See, basically, as I said, it is the dhairya, atmadi vijnanam mano dosha shuddham param. In that, there is something called as dhi. Dhi iti anubhava jnanam, isn't it? So, where basically it has two components: cognitive and behavior. So cognitive is referred to the thinking process, where a person is able to, because if there is abnormal thinking, it results in abnormal behavior. So, like I suppose if I feel that I'm always having the negative thinking, so until unless you change the thinking process, so transforming the thinking process where you're trying to focus on the the whole issues of the thought, the form, the content of the thinking process is called the cognition. And behavior is how a person is reacting, how a person is able to act or behave, or how he is able to modulate is a part of behavior. So when these are combined, this is like ideally there's something called as systematic desensitizations, or the behavioral therapy or relaxation therapy. So they all come under the behavioral therapy, and especially the systematic desensitization, which we commonly use in anxiousness, fear, phobia, flooding therapy, exposure therapies. They all come under the cognitive behavioral therapies. So basically, you're trying to change the thought process and the behavior of an individual by working on this particular thinking and its action. Vata Vidvamsas are said to be effective in aggressive psychiatric patients. So please give your opinion. Yeah, see, of course. See, most of the aggressive conditions are because of Vata and Pitta dominant conditions. And many of the Vata Pitta Hara Shamana Aushadhis, like Vata Gajankusha Rasa, Brahat Vata Chintamani Rasa, Mahavata Vidvamsa Rasa, Brahat Vata Vidvamsa Rasa, and even many of the Vasanta Malati Rasa, they're all said to be beneficial in case of the aggressive episodes. And they are, and especially if you do some other Bhai Parimarjana Chikitsas, like Shirotalam, Shiropichu, Talapodichil, they're all beneficial in case of violent, aggressive patients. Explain the management protocol in psychosexual disorder. See, basically, our focus today was on the mood disorder, so we didn't touch much about the other psychological issues. So basically, psychosexual disorders actually mainly they could be like erectile dysfunctions or premature ejaculations, and perversions like sexual perversions which are there. So always try to look into the normal sexual phase, like starting from the desire, then the excitement, then orgasm, and the refractory phase of a sexual phase, which are mentioned, and try to identify where exactly is the problem. And based on the where the problem is with the arousal, like again, it could be male arousal disorders, female arousal disorders, or orgasmic disorders, etc. So we need to understand. And again, there's a very good book written by Masters and Johnsons on the sexual phase and the management of psychosexual disorders. So you can always look into this book written on the sexual response by Masters and Johnsons on more about the psychosexual disorders. Your insights on genetics and mood disorders and how Ayurveda can help in seeing. See, if you look at the clinical practice, very oftenly we see that there is a very strong family history, and that too in mood disorders. If one of the parent is suffering with mood disorders, there are 30% chances that the child will also have the mood disorders. And if it is both the parents are having some mood disorders, either the depressive episode or the bipolar disorders, there are around 50 to 60% chances that the child would have the psychological problems. So in such conditions, again, the care starting from the neonatal care, like Ayurveda strongly believes in Garbha Samskara, or in case of the Garbhini Paricharya, Sutika Paricharya, and Swarna Prashana, and other therapies can always be done. Again, the genetically, if you see that there is some problem related with the male genetics, you can use the Shukra Shodhaka Aushadis. And if it is because of the female partners, you can always use the Artava or the Stanya and other Shodhakara Aushadis can be advised in the patients.
Sir, thank you so much, sir, again for addressing our queries of our participants. Sir, now I want to conclude the session. Before that, I want to summarize this session, what has happened. Sir, thank you for your informative session. To summarize today's pleasant session, sir started with the definition and the prevalence of mood disorders, definition of mood, different types of mood disorder, and their presentation in clinical scenario. Sir made it easy to understand the diseases with real-life case studies, emphasizing Ayurvedic understanding and successful Ayurvedic management. The queries and doubts of participant addressed effectively in question and answer session. Sir, it's happy to see the model ABCD 4321 model of Dr. Suhas Kumar sir. It's all very useful and very easy to understand and follow, sir. Thank you so much. Sir, now I request Dr. Sanjay Kumar, MD, sir, Professor, Department of Kaya Chikitsa, GMC, Mysuru, to speak few words about the session.
Hello, sir. Hello, Dr. Suhas, sir. For the audience, I should tell that Suhas Kumar sir was motivation for us as juniors. I and sir studied in SDM Hassan in undergraduation. He was our senior. I used to go to him for Shalyatantra related books for reference. He might be remembering that also. Coming to the presentation part, really we are very fortunate to listen to such an authoritative presentation on mood disorders. It is an ideal presentation also, like he has stuck to the topic only and not deviated from the topic, and he has touched all the aspects, probably concentrating on scope and limitations of Ayurveda treatments. And the most important part of this presentation was the discussion of case studies. When it comes to most of the Ayurvedic presentation, the conceptual studies will be very strong. So to back up with a practical the case studies, most of the time it is difficult. A practitioner can do that. So many practitioners are there, but still the documentation part is very lacking in Ayurveda. The bright part, the important part here also, he has well documented every cases. We used to ask Suhas Kumar sir for a presentation related to research methodology and statistics, because it was his hobby. It was not though the core area of his expertise, but as a hobby, he has become expertise in research methodology and statistics also. We have heard his many presentations in different platforms. So once again, I really thank you, sir. I think our objectives were met as far as the topic was concerned, and you have clearly explained on the depression, especially depression, which is very common nowadays, and how we have to go about it in Ayurveda. And the non-pharmacological therapy, basically stressed in Ayurveda, like for mano dosha, di dhairyatma di vijnanam mano dosha shudam param. That was there in your presentation, that the pharmacological therapy is only supportive. So most of the time, the patient requires patience from the doctor that he need to give some time and just to discuss their actual issues. We also come across many cases. The problem is we don't know that they are basically related to pure psychiatric disorder. We get confused, and we have taken a dissertation also on the generalized anxiety disorder this time, thinking that patients who come with non-specific psychosomatic presentations probably may require a different approach rather than physical approach. Rather than physical approach, they require some mental counseling and all. So we'll be in touch with you, sir, for your expertise. Information on such things later also. So once again, on behalf of our postgraduate department of Kaya Chikitsa, our institution, GMC Mysore, and also our HOD, Dr. Maitre Madam, and the postgraduates of all 4 departments of GMC, heartfelt thanks to you, sir, for sparing your valuable time in holidays also. Thanks a lot, sir.
Thank you. Thank you very much. Once again, I'd like to thank the entire team of JMC and wish them great success. Always the Department of Kaya Chikitsa of GMC has really produced various stalwarts, and many of them have been my teachers. I always admire being taught by the postgraduates of the Department of Kaya Chikitsa, and it's a great honor for me to be a part of this particular webinar series. I'd like to thank the principal, the HOD, and the faculties, and all the dear postgraduate students for this wonderful interaction. And again, as Dr. Sanjay was mentioning, if you need any help from my side in terms of any dissertation or even managing any psychiatric cases, I'll be very happy to help you. I think, as I mentioned in my last slide, you can always contact me through the email, or you can put me a message through my WhatsApp. So I'll be very happy to help you. And once again, wishing this great celebration. I'm sure this is one such step in the Golden Jubilee celebrations. We'll have many bigger occasions to celebrate this momentous event of the department. And once again, wishing this department a grand success in all their endeavors. Thank you very much.
Sir, thank you again, sir, for your words, for your guidance, for your cooperation. We need such further cooperation and collaboration with you in future coming